We're in one hospital system at Maine Medical Center, the largest tertiary care center in the state of Maine.
We are the largest neurology practice in the state, but we're also the primary neurology practice in the area. So we serve this community, but we serve the entire state.
We see a very wide breadth of neurology cases here. We see every pathology you could imagine.
I was very surprised by the diversity of pathology I saw just in my first week.
This hospital is a large academic hospital, but the feeling within each of the departments is of a small family.
It is a brand new program. I'm a part of the first class just starting in 2020. The enthusiasm for the program among our attendings was really high.
Our entire practice is made up of folks who enjoy teaching.
We have all the right parts for a great program. We have met all the standards for ACGME. We have our accreditations.
We have a long-term history of good graduate medical education in our hospital with other residencies. And because of that, our neurology program is really supported in the development of a new program. Medical students who are coming here to be, some of the first neurology trainees here are going to have the opportunity to shape the education as we move forward.
It was nice being able to be part of building something new, have a lot of input in what changes and what works and what doesn't. So that would be very resident-driven in that way.
So the program's front-weighted. In the beginning, you just learn a core of basic neurology.
Well, everyone needs to be very comfortable with the most common neurologic things, new onset seizures, stroke.
As residents get into their second and especially their third and fourth years, they have a very ample amount of elective time, which is where they can explore different specialties, gain expertise and skills in different fields.
Because we're a tertiary referral center, we see all of the most interesting neurology cases.
I was so scared during my first kind of real rotation.
I was really nervous.
A lot of very complicated patients.
But coming in, all the other residents have been really nice to get to know and to work with.
The residents I was with were just so supportive. They were always there to help me out and to teach me through these situations.
There's always someone around to help you. You're never alone. You have a lot of autonomy, which is really great for learning, but if you need someone, there's always someone there.
All the trainees know all of the faculty by first name. We all share our cell phone numbers together. There's no worries at any time that you can't ask for somebody to help you with something.
The attendings are very approachable. They're very down to earth and easy to talk to.
We have a long history of being involved with the Maine Medical Center Research Institute, or MMCRI.
Neurology residents are going to carry a longitudinal research project. There's 1 month per year devoted to that.
So my attendings offered a lot of support in helping get that going, planning it, and it's going to be over the next 4 years.
We want residents who want to be here, who love neurology, who want to take good care of their patients, and have a lot of fun while they're doing it.
We've always sort of felt it very important to have the work-life balance, and so you have to live somewhere that you can really enjoy your time outside of work to decompress from a stressful day.
They do definitely take wellness into consideration.
And it's not one of those places where work is more important than life.
You have to like your life to be good at anything, so we try to give residents a very good balance between the two.
Portland is just an absolutely fantastic city to live and work in. It's like the perfect size.
The ability to go out from city environments to out into the greenery was very easy to do.
The ocean is our neighbor, which is a huge bonus in my eyes. And then Portland itself is a really cool town. It's got really cool down-to-earth vibes that I can appreciate.
You're gonna get a very similar education anywhere you go. You're gonna learn the same things, but how you learn them and what you do outside of that time, that's the big factor.
Our main goal is to have the residents develop into the kind of neurologists they want to be, whether that's academic or in private practice. We're here to support the residents and help them develop into who they want to be.